Can big tonsils cause sleep apnea? If you've ever wondered whether big tonsils could be the reason behind your or someone else's sleep apnea, you're not alone. Let's break down the connection between enlarged tonsils and sleep apnea. First, let's understand what sleep apnea is. It's a condition where you stop breathing for short periods during sleep. There are two main types: obstructive sleep apnea, which is caused by a blockage in the airway, and central sleep apnea, which is related to brain control over breathing. Now let's talk about tonsils. Tonsils are small, oval-shaped pads of tissue at the back of the throat. When they become enlarged, they can narrow the airway, especially during sleep. This narrowing can cause obstructive sleep apnea. For children, enlarged tonsils and adenoids are a common cause of sleep apnea. In fact, it's one of the most frequent reasons why children experience pauses in breathing during sleep. The same principle applies to adults. If the tonsils are significantly enlarged, they can block the airway and lead to sleep apnea. Studies have shown that adults with markedly enlarged tonsils can benefit significantly from tonsillectomy, which is the surgical removal of the tonsils. For example, one study found that after undergoing tonsillectomy, the average apnea-hypopnea index, which measures the number of breathing pauses per hour, decreased dramatically from 40 to 7 events per hour. This improvement was seen in adults who were not substantially overweight and had no other significant health issues. Enlarged tonsils can cause symptoms such as loud snoring, pauses in breathing, and restless sleep. These symptoms are similar in both children and adults. In children, enlarged tonsils can also lead to other issues like frequent colds, middle ear infections, and even problems with speech and swallowing. While not all adults with sleep apnea have enlarged tonsils, for those who do, surgery can be a very effective treatment option. However, it's important to note that tonsillectomy is generally considered for patients who cannot tolerate or benefit from other treatments like positive airway pressure therapy, CPAP. In summary, big tonsils can indeed cause sleep apnea by narrowing the airway and blocking airflow during sleep. If you or someone you know is experiencing symptoms of sleep apnea and has enlarged tonsils, consulting a healthcare provider about the possibility of tonsillectomy as a treatment option is worth considering.